with a small program, you get a lot of experience without having fellows, without having to fight other residents for procedures. You just get to do a lot of things on your own or assisting attendings. So I like being in the ER and in the PICU and in the NICU and getting to do procedures. I like intubations, I like central lines, I like IOs. So I think all of that's really fun, and we kind of get first dibs on that.
So my favorite experience in residency was actually a lot of the downtimes in between seeing patients, where I got to talk with my fellow residents and talk with attendings and develop relationships that made me a better doctor, made me reflect more on my learning, and really just made the whole residency experience a lot more richer, a lot better, just let me cope with how stressful things were at times. Those are always the things that I look back to as what was the most fun part of it for me.
You get the widest variety of pathologies, and you have to make quick decisions, and those decisions are very important to stabilize the patient, and that's really good use for the future when you have more time to make decisions for these patients, and you just learn a lot about pediatric knowledge from the ER.
I want to go into primary care, and so I really love my continuity clinic, and the fact that we are seeing patients on our own and talking with our attendings about them, and from a primary care perspective. And it's just even there, it's a family feel, and I've really enjoyed that a lot.
My favorite training experience during the program would be doing a PICU at nighttime. I think that's really a time for you to develop your skills, and you get a lot of autonomy, and you get to care for critical patients and have some support, but also know that you are the doctor on all night and you're the only physician in-house for the PICU. So it makes you become a little bit better at making decisions. And I love acuity and I love procedures, and since we do not have fellows here, we get first pick at all of those procedures.
I think what I liked the most about training at Blank was, one, the independence that you get. At a lot of programs now you have a lot of supervision, and here at Blank you have a nice balance of supervision but autonomy. So there are a lot of rotations that you can do in which you are allowed to make the decisions first, or you're doing hands-on procedures, or you're the ones that are making the calls. And I think that the attendings respect that and expect that of you, and I think that's very unique.
There's a lot of things that I loved about working at Blank. Blank Children's Hospital is in a really unique position. Des Moines has a population big enough to warrant an academic center, but we have the community feel. The nice thing about that is we get to work up, diagnose, and treat the zebras, but there's also an overabundance of general pediatrics. We also don't have fellows, so we get to do a lot. The people get to know each other really well, so I know my co-residents very well, and then the attendings all know me. And that allows me to maximize my learning on every single rotation.